Follow the Crumbs, a case of near-fatal bradycardia caused by accidental cannabis intoxication. Marijuana is the most widely used illicit drug worldwide. Recent studies have shown that cannabis may have therapeutic properties, prompting the campaign for its medical legalization. Marijuana consumption among older U.S. adults in particular has doubled since 2014, with edible formulations being more popular than inhaled cannabis. Here, we discuss a case of accidental cannabis consumption in an elderly male, leading to a nearly fatal bradyarrhythmia. A 74-year-old male with a past medical history of hypertension and COPD presented for 1 day of dizziness and near syncope. The patient was spending time with his daughters when he became progressively dizzy and altered throughout the day. In the ER, the patient was bradycardic with a heart rate ranging from 23 to 45, which resolved after 1 episode of emesis. On exam, he was diaphoretic and intermittently confused. His initial EKG showed sinus bradycardia with a heart rate of 45. The patient then became unresponsive and a code blue 90 was called. On evaluation, his heart rate was 23 and blood pressure was 108/78. He received 0.5 milligrams of IV atropine and 1 liter of IV fluids, which resulted in improvement in mental status to baseline. Telemetry was reviewed and showed sinus bradycardia and a 3-second sinus pause without evidence of AV blockade. The daughter then arrived to bedside and told us that her father accidentally ate cannabis cookies. The recommended oral dose was 1/8 of a cookie. However, the patient consumed 3 entire cookies. His urine drug screen was only positive for THC. Cardiology was then consulted for evaluation of symptomatic bradycardia. Further ischemic workup, including echo and stress test, was negative, with no overt etiology for bradycardia. The patient was discharged with a 30-day event monitor that showed an average heart rate of 70 beats per minute with no significant tachycardia or bradyarrhythmia noted. His symptomatic bradycardia was therefore attributed to accidental cannabis toxicity. Edible cannabis is associated with a high rate of emergency room visits due to intoxication, adverse reactions, and psychoactive effects. Cardiovascular adverse effects from oral cannabis account for up to 20% of emergency room visits due to cannabis use. With the recent campaign for the medical legalization of cannabis, edible formulations have become increasingly popular. Newer forms of cannabis can be up to 10 times more potent than older forms, increasing the risk of cannabis-related adverse events. CBD and THC are the most studied cannabis compounds. CBD acts on adenosine receptors, causing antiarrhythmic effects. High concentrations of CBD lead to bradycardia via adenosine receptor activation. THC activates CB1 receptors, which leads to sympathetic inhibition and increased vagal tone, thereby causing bradycardia and hypotension. THC is also responsible for the psychoactive effects of cannabis. The variable absorption of oral THC and delayed onset of action can lead to accidental overconsumption, especially in naive users. Although adverse effects of cannabis are rare, oral cannabis formulations can cause severe, potentially life-threatening bradycardia. Given the rapidly changing laws regarding cannabis use, further investigation of the cardiovascular adverse effects of oral cannabis is required. Our case highlights the impact the new legalization of marijuana can have on patients, especially the elderly, who may be more prone to cardiovascular risk factors when ingesting cannabis-based products. Therefore, a thorough history and physical exam is vital, as accidental ingestion of cannabis is increasing as these products are becoming more readily available in the United States. Thank you.